So today we'll be learning the anatomy of the articulated hand. So let's start, inshallah. So this is the articulated hand, and three types of bones are present here. So they are proximally, these are the carpal bones, and these are the metacarpal bones, and these are the phalangeal bones. So let's talk about the numbers of the bones. So carpal bones are 18 number, metacarpal bones are 5 in number, and phalangeal bones, these are 14 in number. So the carpal bones, they are organized in two rows. So there is proximal row and there is distal row. So lateral to medially, these bones are scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, and capitate hamate. So the hook of the hamate, this is the hook of the hamate. This hook of the hamate projects from the palmar surface with its concavity directed laterally. So this direction of tip of the hook of the hamate determines the side of the articulated hand. So this is the articulated hand on the left side. So if I put this in my right hand, so this hook of the hamate, tip of the hook of the hamate, it would direct medially. So this is not the right-sided articulated hand. So this is the left-sided articulated hand. So now let's talk about the shape of the carpal bones. So this is the scaphoid bone and it is boat-shaped. This is the lunate bone, it is moon-shaped, and this is the triquetral bone. This is wedge-shaped, and this is the pisiform bone. This is the P-shaped, and this is the trapezium. It is quadrilateral in shape. Trapezoid, this is shoe or boot shoe shaped, and this is the capitate bone, and it is the largest bone. And hamate, this is the hamate bone, this is wedge shaped, and there is a hook of the hamate. So ulnar nerve, it passes along the hook of the hamate. This is the palmar surface, and this is the dorsal surface. So the carpal bones, these are morphologically short bone. So why they are called short bones? Because they are cubical in shape, and they have 6 surfaces. 4 surfaces are articular and 2 surfaces are non-articular. So the non-articular surface, that takes attachment with the muscle. And in case of the carpal bone, the palmar surface and the dorsal surface, these are non-articular except the triquetral and the pisiform. So in case of these two bones, this is the triquetral and pisiform. So the dorsal surface of the pisiform articulates with the palmar surface of the triquetral bone, and the dorsal surface is more extensive than the palmar surface, except the lunate bone. So in case of the lunate bone, the palmar surface is more extensive. That's why more dislocation takes place in the lunate bone, because its palmar surface is more extensive, and more fracture takes place in the scaphoid bone. So the arteries supplying the scaphoid bone are in relation with the wrist joint. So when they are fractured, so there is development of the vascular necrosis, and articulations don't take place along the margins of the marginal bone. So this is the lateral pillar and this is the medial pillar. Lateral pillar is formed within the tubercle of the scaphoid bone and the crest of the trapezium bone, and medial pillar is formed within the pisiform and the hook of the hamate bone. We know that most dislocation takes place in the lunate bone. So because this palmar surface is more extensive and it compresses the median nerve, and this syndrome is called carpal tunnel syndrome. This is scaphoid and lunate articulates with the lower surface of the radius bone, and it forms the wrist joint. So wrist joint, it is basically an ellipsoid type of synovial joint. There is another bone, ulna. So ulna does not take place in the wrist joint formation. So there is no involvement of ulna in wrist joint formation. Now let's talk about the pisiform bone. So this bone, it is basically, this is the pisiform bone, this is the sesamoid bone. So what are the criteria of sesamoid bone? So it is basically P-shaped. It actually develops in tendon of the muscle, it ossifies after birth, and it is devoid of periosteum, and there is absence of Haversian system. So this pisiform bone, it develops from the tendon of the flexor carpi ulnaris. So there is another question, that is, what is the longest sesamoid bone of our body? So the answer is patella. So the patella develops from the tendon of the muscle quadriceps femoris. Now let's talk about the metacarpal bone. So lateral to medially, this is the first metacarpal bone, this is the second, third, fourth, and fifth metacarpal bone. So it has 3 parts. So this is the proximal part, this is the shaft, and this is the distal part. And the first metacarpal bone is the shortest, strongest, and the stoutest of all metacarpal bones. The base lies in the proximal part and the head lies in the distal part. In case of shaft, there are 4 surfaces. This is the palmar surface, this is the dorsal surface, this is the medial surface, and this is the lateral surface. So this is the trapezium bone. So trapezium bone, this articulates with the base of the first metacarpal bone. The trapezoid bone, it articulates with the base of the second metacarpal bone. And this capitate bone, it articulates with the base of the second, third, and fourth metacarpal bone. And hamate, it articulates with the base of the fourth and fifth metacarpal bone. So morphologically, these metacarpal bones are the miniature long bone. So why it is called long bone? Because it transmits the body weight. And why it is called the miniature bone? Because it is structurally small. In case of long bone, there is 2 epiphyses and 1 diaphysis, but in case of miniature long bone, there is 1 epiphysis and 1 diaphysis. In case of the first metacarpal bone, the epiphysis lies in the base, and in case of the rest of the 4 metacarpal bones, the epiphysis lies in the head. Now let's talk about the phalanges bone. So there are 14 phalanges bone. So there are the proximal phalanges, the intermediate, and the distal phalanges. But in case of the thumb, there are only 2 phalanges. But in case of rest of the 4 digits, there are 3 phalanges in each. This is the proximal phalange, this is the intermediate, and the distal phalanges are absent here in this bone. These phalanges are also the miniature long bone, and it has also 3 parts. This is the proximal part, this is the intermediate part, and this is the distal part. So base lies in the proximal part, and in case of intermediate part, there is shaft and head lies in the distal part. Now let's talk about the ossification of the carpal bone. It goes like in a spiral manner. It goes like the capitate hamate, and also the triquetral, lunate, scaphoid, trapezium, trapezoid, and then the pisiform bone. So the capitate and hamate bone, it ossifies at the 1st year of life. The triquetral, it ossifies the 3rd year of life. Lunate is 4th year of life, and scaphoid is 5th year of life. Trapezium, 6th year, and trapezoid is 7th year of life. Pisiform bone, it ossifies the 12th year of life. Now let's talk about the joints of the articulated hand. So the wrist joint, we have learned about the wrist joint. So it is also a type of synovial joint. And between the carpal bones, there is intercarpal joint, and this is plain type of synovial joint. And carpometacarpal joint, between the carpal and the metacarpal bone, this is the plain type of synovial joint. But the first carpometacarpal joint, it is saddle type of synovial joint. There is metacarpal phalangeal joint between the metacarpal and phalanges. So this is the ellipsoid type of synovial joint. And there is the interphalangeal joint between the phalanges. It is hinge type of synovial joint. So now let's talk about the movement. So in case of the hinge type of synovial joint, we see the flexion and extension in one side. But in case of the wrist joint, we can see the 5 movements here. These are the flexion, extension, abduction, adduction, and circumduction. This is the flexion, this is the extension, this is the adduction, this is the abduction, and this is the circumduction. Let's talk about the muscles which are involved in these movements. So in case of the flexion, there is involvement of flexure carpi radialis, flexure carpi ulnaris, and palmaris longus. So we would see the flexure muscles. In case of extension, there is involvement of extensor carpi radialis, extensor carpi radialis brevis, extensor carpi radialis longus, and extensor carpi ulnaris. In case of abduction, there is involvement of the radialis muscle. So there is flexor carpi radialis, extensor carpi radialis longus, extensor carpi radialis brevis, extensor pollicis longus, and abductor pollicis longus. In case of the adduction, there is involvement of the ulnaris muscle. So there we would see the flexor carpi ulnaris and extensor carpi ulnaris. And in case of circumduction, we will see the involvement of all the muscles here. Now let's talk about the anatomical points. So we'll place it like this. And this is the articulated hand on left side. Carpal bones lie proximally. Phalanges bone lie distally. And the first metacarpal bone, this is the strongest, toughest, and the shortest bone. And the concavity of the palmar surface is directed upwards. So this was all about the anatomy of the articulated hand. Thank you.